What is the best anxiety medication for a teenager? This question is becoming increasingly relevant as nearly 1 in 3 adolescents grapple with anxiety disorders. In these trying times, it's crucial to remember that psychotherapy often stands as the first line of defense. But what happens when anxiety symptoms persist, refusing to back down? That's when we turn to medication, a powerful ally in our fight against anxiety. So, let's delve into some of the commonly prescribed medications. Selective serotonin reuptake inhibitors, or SSRIs, are often the first choice of medication. Now you might be wondering, what exactly are these SSRIs? In simple terms, they work by increasing the amount of serotonin, a neurotransmitter, in your brain. This can help balance your mood and reduce feelings of anxiety. There are several types of SSRIs that are commonly prescribed for teenagers. These include fluoxetine, more commonly known as Prozac, sertraline, which you might know as Zoloft, and escitalopram, also known as Lexapro. Each of these has been shown to be effective in managing anxiety disorders. However, it's important to remember that like all medications, SSRIs can come with potential side effects. Some young people may experience nausea or headaches, while others might face sexual dysfunction. It's crucial to discuss these possibilities with your healthcare provider to make an informed decision. While SSRIs are generally considered safe and effective, there are other options if they aren't the right fit. Scene script. Beyond SSRIs, there are other medications that may be considered. Diving right into it, we have serotonin and norepinephrine reuptake inhibitors, also known as SNRIs. These are usually considered as second or third line medications for treating anxiety in teens. Some examples include venlafaxine and duloxetine. Just like SSRIs, SNRIs increase the amount of serotonin available in the brain, but they also boost levels of norepinephrine, another brain chemical that can influence mood. However, it's important to note that they can have higher behavioral and cardiovascular side effects compared to a placebo. Moving on, we have a type of azapirone medication, Buspirone. This can help reduce anxiety symptoms in teens without the sedative effects that some other medications might have. It's a different class of medication, working on a different set of brain chemicals to ease anxiety. Next up are antihistamines, specifically hydroxyzine. Yes, you heard it right. An antihistamine, commonly used to treat allergies, can also have anti-anxiety effects. It's often prescribed for anxiety disorders in teens, offering a different approach to traditional anxiety medications. Another medication sometimes used, albeit less commonly, is Propranolol, a beta blocker. While it's often used for treating heart conditions in adults, it can also be used off-label to treat anxiety. However, it's less commonly used for anxiety in teenagers. It's worth noting that tricyclic antidepressants and benzodiazepines are rarely used for children and adolescents with anxiety disorders. These medications can have more severe side effects and can potentially lead to dependency, making them less ideal for this age group. Each of these medications has its own potential side effects and considerations, and what works best will depend on the individual's specific symptoms, overall health, and their response to medication. It's crucial to have these discussions with a healthcare provider to determine the best course of action. Remember, these medications are not a one-size-fits-all solution. So, what is the best anxiety medication for a teenager? That's a question we've been unpacking in this video. Let's summarize what we've discussed. Selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed medications for teens grappling with anxiety disorders. These include fluoxetine, sertraline, and escitalopram. They work by increasing the amount of serotonin available in the brain, helping to regulate mood. However, like all medications, they can have side effects such as nausea, headache, and sexual dysfunction, but SSRIs are not the only option. There are also serotonin and norepinephrine reuptake inhibitors, or SNRIs, which might be considered as second or third line medications. These include venlafaxine and duloxetine. There are also other types of medication like Buspirone, Hydroxyzine, and even Propranolol, a beta blocker. But remember, the use of these varies and is less common. One thing we can't stress enough is the importance of individual fit. What works best for one person might not work for another. It's crucial to remember that while medication can be a valuable tool in managing anxiety, it's often most effective when used in combination with other treatments like psychotherapy and family education. And remember, if anxiety becomes overwhelming and starts to interfere with daily activities, it's important to seek help. Anxiety is a common issue among teenagers, with nearly a third of adolescents developing an anxiety disorder. But the good news is, it's treatable. Ultimately, the best medication will depend on the individual's circumstances and should be decided in consultation with a healthcare provider.